Hey, what's up, good people? Today we're going to talk about heart disease. Hey, what's going on, good people? It's your boy James Harris, founder of a movement called Mental Heal, which focuses on men's overall wellness, the mental health, physical health, and of course, the emotional health. And I'm also the author of a book called Man Just Express Yourself, which is an interactive planner guide for boys and men to better express themselves. I definitely appreciate my fellas who went out and got this tool to work on now. Thyself, I definitely appreciate that. Salute to my fellow clinicians who got this in their lobbies or doing these interventions and in session. I definitely appreciate you. And of course, praises to my spouses who got this tool to give it to the males within your life and doing these, having these conversations over dinner and date night and things like that. And of course, praises to the parents who got this tool for the young males in their lives. I'm glad to see that you guys are working on these tools together. Definitely appreciate it. And if you want to get a copy of the book, definitely go to Amazon, Barnes& and Nobles, Target, Walmart, pretty much anywhere books are sold, including my website. And while you're on my website, be sure to check out my board game, Cheesy Dates, which is an interactive game for couples, adult game nights, your girls' night, your boys' night, just a series of different questions and ideas that can help you regardless of what stage of the relationship you're in. So definitely be sure to check out that. And if you're new here, make sure you like, share, subscribe. I definitely appreciate you. And if you've been here for a while, thank you, thank you, thank you. We're monetized now, so definitely couldn't have done it without you. So you ensure that you continue to stay liked, continue to share videos, stay subscribed. I definitely appreciate that. So when we talk about heart disease, it's definitely something near and dear to me because heart disease is number one killer among African American men today. So we definitely have to ensure that we're educated on what heart disease is. So to break it down, heart disease can be described of a wide range of conditions to affect your heart. Different blood vessels, diseases, of course, has been linked as that as well. So you got coronary artery disease, heart rhythm problems, heart defects that you could have been born with, heart valve disease, diseases that can affect your heart muscles. You got heart infections. It's just a wide range of different things involving the heart and different diseases. Many forms of heart disease definitely can be prevented or treated with different healthy lifestyle choices. So we're going to talk about a lot of different things in here. And I definitely want to ensure that we talk about the symptomology of it because I want you to be able to recognize it for not only yourself, but for your loved ones, just in case. And of course, I encourage you to do your own research too and consult with your doctor. So hopefully, you're getting your yearly physicals that you should be getting, fellas. I definitely encourage you and employ you to do those things. Because again, heart disease can be prevented and it can be altered with different lifestyle changes. So, heart disease symptoms depend on what type of heart disease that you possibly have. A buildup of fatty plaque tissues around your different arteries, those things can be identified early with early detection. Plaque buildups causes narrow blockage ways within the blood vessels that can lead to heart attack, chest pains, and different strokes. So we definitely want to ensure that we checking those things out. We're on top of those. Coronary artery disease symptoms may be different for men and women. So again, uh, women tend to get more physicals on a regular basis than men. Checkups, all those things. So, fellas, it's definitely important that you're taking care of your body, not only for yourself, but of course for the people vicariously around you. Men and women, men are more likely to have the chest pain with those different symptoms. Women are more likely to have other signs and symptoms along with chest discomfort, such as shortness of breath, um, nausea, extreme fatigue. So all of those things are signs of heart disease. When we're talking about more signs and symptoms, we can't ignore the fact that chest pain is definitely a symptom. Tightness within your chest, chest pressures, chest discomfort is definitely something to recognize within heart disease. And if you got shortness of breath, you want to ensure that, and it's not linked to like cardio issues, so you want to ensure that your heart is working. You want to ensure that you are putting yourself in a position to, be well overall. So definitely increase your cardio. But shortness of breath is a sign. Pain, numbness, weakness, or coldness within your legs or your arms. If the blood vessels are in the part of those bodies are narrow. I know a lot of people don't think to associate, heart disease with other extremities of the bodies, but yes, it can be linked. So definitely ensure that you are putting yourself in a position to take care of your overall wellness, your entire body, not just that specific region of the body in which you're talking about. Some people have pain in their neck. Some people have pain in the jaw or the throat or the upper abdomen. So you definitely want to ensure that, and back problems. All of those things can be linked to heart disease. So ensure that you're taking care of your overall wellness. Cardiovascular disease can also sometimes be found early with regular evaluation. So make sure, again, the importance of getting the physical is definitely something that you should be doing. You know what I'm saying? Whether you're a man or a woman, but it's definitely important that you do those things. Heart disease symptoms can be abnormal heartbeats. You probably heard it before. Like, I want to say it's the arrhythmias. But listen, abnormal heartbeats, of course, is something that you probably experienced as a child. As a matter of fact, I think I had an abnormal heartbeat when I was a child, but I grew out of it. Fluttering in your chest is probably what it is. Raising heartbeat, you definitely have potential slow heartbeats, chest pain or discomfort. Shortness of breath, again, is also a symptom of abnormal heartbeats. Lightheadedness, that's a sign of symptom. Dizziness. Some people even faint or come to the possibility of nearly fainting. So heart disease symptoms can be caused by different heart defects as well. Serious heart defects that you can be born with, and a lot of people don't know that until they continue to get checkups as they're growing, and then they can identify it and link it back to birth. But hopefully you're fortunate, you got a good pediatrician, you got a good prenatal staff and all that, to where they can see these things while you're born, and then of course you continue to grow and get these things treated. Pale gray or blue skin coloration, those definitely a sign of heart defects. Swelling in the legs, other limbs, abdominal areas, and issues around your eyes too. So again, all of this is important to identify signs and symptoms of heart defects. If you're an infant, you can get shortness of breath during those feelings, leading poor weight gain. All of that contributes to heart disease and heart defects. Congenital heart defects, they usually aren't immediately life-threatening. Of course, it's something that you can continue to work on as you continue to make lifestyle changes. Some people be getting shortness of breath doing exercise or different activities, easily tiring doing exercises. And again, like I said, you got the swelling in those extremities, whether it's feet, ankles, or your hands. So definitely pay attention to that. Another sign and symptom of heart disease is also the heart muscles. The areas around the heart. In early stages of cardiomyopathy, you may have signs, or you may even have no symptoms at all. So breathlessness is without activity. Like if you're at rest and you all of a sudden get shortness of breath, those things can happen. Swelling in your legs, ankles, and feet definitely is a part of that as well. Fatigue, irregular heartbeat that can go faster or pound a little bit heavier or start fluttering. Those also signs. And a lot of people reported also signs of dizziness, lightheadedness, and some people even fainted with cardiomyopathy. Heart disease can be caused by different infections as well. So endocarditis is also an infection that can cause inner lining of your heart chambers to, have issues with the heart valves. You can have a fever, you can have shortness of breath, you can have weakness and fatigue, you can have swelling in your legs, your abdomen, changes in your heart rhythm, dry or persistent cough, skin rashes, different unusual spots that you may have not noticed before. So all of those things are important. So be sure to check out everything. But of course, you got to make sure that you can physicals and going to your doctor when you need to. Heart valve problems are definitely other signs and symptoms of heart disease. So the heart itself has 4 valves: the aorta, the mitral, the pulmonary valve, and the tricuspid valve. That opens and closes to direct blood flow through your heart. So all of those 4 work together to ensure that your heart is beating properly. Many things can be damaged with your heart valves, leading to a narrow, leaking, or just improper closing. So those things are definitely important. And of course, you want to ensure that your doctor is taking care of those things. Depending on which valve isn't working properly, you can get fatigue, shortness of breath, irregular heartbeat, the chest pain, the fainting. all of those things. So you definitely want to ensure that you're putting yourself in a position. So you should know when it's time to see a doctor. When you have chest pain that's constant or just repeatedly, like, I don't want you to ignore that. I want you to ensure that you're putting yourself in a position to see a doctor. Shortness of breath is definitely, if it's unusual, you definitely want to ensure that you're seeing a doctor. If you faint for any reason, you might want to see a doctor. Heart disease is easy to treat when detected early, so that you can talk to your doctor about your concerns or the different symptoms that you probably had. If you're concerned about developing heart disease, talk to your doctor about the steps that you can take to reduce heart disease. Again, like, different things can be altered with lifestyle choices, but of course, you want to ensure that you're putting yourself in the best position to ensure that you're catching these things early. And while we're doing that, you should know that there's different risk factors that you should be able to identify, even within yourself or your loved one. Of course, age is a definitely factor. So growing older increases your risk of damage and neural arteries, and of course weaken your heart muscles overall. So it's definitely important that you know that too. And when it comes to gender, of course, men are greater risk for heart disease. Women are at risk as well, but this is more after menopause stage. So they got way more time and women tend to go to the doctors more, so it's easier for them to get their symptoms caught early. So when we talk about other risk factors too, we can't ignore the fact that family history also plays a part in this. So a family history of heart disease increases your risk of coronary artery disease, especially if a parent developed it in an early age, probably before they were 55, or if they were a male. Those things are definitely important. So ask your brother, your father, your uncle, those people within the family, if they knew about another loved one or family member that had heart disease. And of course, smoking. Yes, nicotine tightens your blood vessels. It also adds carbon monoxide. It can be a damage for the inner liner, actually, within your heart area, which is definitely important. So heart attacks are more common in smokers than any other group, especially non-smokers. So, and again, if you got a poor diet, these things also can increase the fact that you may put yourself at risk, because if you have a poor diet, which means that you're eating increased fats, increased salt, sugars, and your cholesterol might be higher too, and it can contribute to you developing heart disease. And also, heart disease might be one of the risk factors that will lead you to, or in addition to, having high blood pressure. Uncontrollable high blood pressure can result in hardening or thickening the different arteries, narrowing your vessels throughout your blood flow, which can prevent different blood flow actions and can increase your risk of having a heart attack. So high cholesterol, I'm telling you about that. Diabetes also, that can go in tandem. Diabetes increase your risk of heart disease. Both conditions are pretty similar when it comes to risk factors. And excuse me, of course, we want to identify that if somebody is obese or have high blood pressure, that can also have an impact on having heart disease. Obesity is pretty much the excess weight typically worsens other heart disease factors. So you definitely want to ensure that you are physically inactive or physically active, and prevent being physically inactive, because the lack of exercise is also associated with many forms of heart disease and also can put you at risk. So you definitely want to ensure that you're being better about being active. Stress is also another one. So unrelieved stress over a long period of time may damage your arteries or worsen the risk of the factors of you having heart disease. So if you always tense, or you always hypervigilant, or you're always worrying excessively, those things can be factors in you having heart disease. And one big one that a lot of people tend to ignore or not even associate: poor dental health. It's important to brush and floss your teeth, so your gums won't contribute all that plaque buildup. Get your dental work checked regularly, as much as you do with the physical health, your mental health, but also your oral health is definitely important too. Germs can enter your bloodstream and travel to your heart from your poor dental work. So make sure you're doing that. When you're doing that as well, don't forget the factor of heart failure. One of the most common complications of heart disease, heart failure, occurs when your heart can't pump enough blood to meet your body needs. So your heart is not dispersing blood where it needs to go in a timely manner. Heart failure can also result from many forms of heart disease, including heart defect, cardiovascular disease, valvular heart disease, um, and heart infections. All of those things are definitely important, which can lead to a heart attack at the end of the day. Heart attack is pretty much the blood clot blocking the blood flow through the blood vessels that feed your heart, causing the heart attack, possibly damage or destroying part of your heart muscle. Um, Heart attacks are definitely something that you probably are common with, like from seeing it on TV or just hearing about somebody previously within your family. Another one that you probably associate with, familiar with, is probably strokes, which is the risk factor that can lead to cardiovascular disease, can also lead to a different type of stroke, which happens when the arteries to your brain are narrow, which blocking the blood as well as the oxygen from reaching your brain. A stroke is a medical emergency. Brain tissue begins to die within a few minutes of having a stroke. You've probably seen people who are paralyzed on one side or their mouth is twisted. All of those things are definitely important for you to be able to recognize. And you probably even heard of some people having aneurysms, which is a serious complication that can cause anywhere in your body. And aneurysm is a bulge in the wall of your arteries. If you have an aneurysm and it like burst or is inflamed, then it may be definitely life threatening, and you probably can have internal bleeding from it as well. So it's definitely important that you take care of those things. You got to be able to identify them. Artery disease is when you develop different things, not only just in your heart area, but of course your legs. It deceives, like you're not receiving enough blood flow throughout your body. This may cause symptoms of leg pain when walking. All of those things are definitely important. So make sure you're identifying different symptomology. But of course, if you're getting your physicals yearly, it'll be easier for you and your doctor to be able to catch it and prevent it, or put you on medicine, or assist you on lifestyle changes. All of those things are definitely important. That's why physicals are definitely important. Sudden cardiac arrest is another form of heart disease. Sudden cardiac arrest is, of course, unexpected loss of heart functioning, breathing, or consciousness, often caused by arrhythmia. Sudden cardiac arrest is definitely, again, another medical emergency. If not threatening immediately, it can cause sudden cardiac arrest or death. And of course, as we're doing these lifestyle changes or we're getting our physicals yearly, we can identify different ways to prevent certain things. So certain type of heart disease, such as heart defects, can be prevented. Try to reduce your smoking or don't smoke at all. Control other health conditions, such as if you do have high blood pressure or high cholesterol or diabetes. Those things are definitely important. Exercise for at least 30 minutes a day. More days is better if possible. And it definitely should be cardiovascular somewhere in there. So don't just lift or do yoga or things like that. You definitely want to ensure that you're doing cardio. So walking, running, swimming, those things are definitely important. Eat a diet with low salt or saturated fats. Those things are definitely beneficial. Maintain healthy weight. So don't feel like you have to be a certain body type of body style, because obesity is real, body shaming is real. Body dysmorphic is also real. So be sure that you're putting yourself in a position to be healthy, to maintain your body weight. Reduce and manage stress properly. So that's definitely important too, because you don't want to be in a situation again to where you're overstimulated, hyper vigilant, or just overstressed constantly. And you definitely want to ensure that you're practicing good hygiene, because those things are definitely important. So definitely be sure that you are putting yourself in a position to identify these things or be willing to make the necessary lifestyle changes. So in order to be diagnosed with heart disease, your doctor will perform different physicals and talk to you about your medical history, your family history, all those things. And of course, they'll put you through a series of tests, diagnose you with heart disease. Depending on what condition your doctor may find, of course, they'll do blood work, they'll do chest x-rays, hook you up to an ECG or EKG, depending on what it is. So it's all different things in different ways so they can do this. And of course, they will probably have your results within 72 hours, just depending on what doctor you go to. They might send you off to a specialist. They probably even make you do a stress test, which is a type of test that involves raising your heart level rate different exercises, different medical medicines to perform different tests to see how much your heart responds to the stress, or see how much blood your heart is pumping out throughout the rest of your body. And of course, when they do all that, they're able to identify and diagnose you, and then the treatment comes. So it's different type of treatment that you'll receive depending on the type of heart disease you may have. But the number one change that they probably require you to make is lifestyle changes. So you can lower your risk of heart disease by eating low fat, low sodium diets, getting exercises within at least 30 minutes, moderate your exercise different days of the week. Another big one, they might definitely tell you quit smoking and limit your alcohol intake. But, it depends on where you are. If you're too far gone, or it's more safer and manageable to give you better medication, then they definitely probably do that as well. Although they will encourage you still to do those lifestyle changes. So definitely, be prepared to do that. So if you got any questions or know somebody who has heart disease and this probably is familiar to you, let me know what you think. I definitely appreciate you checking in. Hopefully you learned some. Hopefully you got some information that you can share with the loved ones in your life. I definitely appreciate you. I'll catch you on the next one.